be we're also recording it, so it will be available after the presentation. So don't panic if you missed something, if you didn't quite hear something. If you want to be able to go back and look at any of the visuals that we're going to be going through, you will have the opportunity to do that through both through the recording and through the slides and handouts that are going to be emailed out to everyone after the presentation is over. So NAMI-NYC, the host of this event, is the National Alliance on Mental Illness of New York City. We're a grassroots mental health organization dedicated to providing support, education, and advocacy for all individuals and families impacted by mental illness. This means that we have support groups and classes and other free services that are currently being offered via Zoom for individuals that are dealing with their own mental health issues, and also for people who are supporting somebody who's struggling with a mental health issue. Whether it's a family member, a friend, a child, a parent, a sibling, a spouse, whatever your relationship is, if you're supporting somebody who's having a really hard time and you want to get support for yourself, you can do that through our support groups and classes and other support programs. Again, all of our services are free of charge, and you can find out more by going to our website, NAMI-NYC.org, or by calling our helpline. We're going to be putting the helpline information in the chat as well. But for anybody that's listening in and can't see the chat, that number is 212-684-3264, or you can email us at helpline@NAMI-NYC.org. All of our services are peer-led, which means that our support group for people living with bipolar disorder is facilitated by people living with bipolar disorder. Our support group for people living with anxiety and depression is facilitated by, you guessed it, people living with anxiety and depression who have also been through a training and have received other training to be able to facilitate. Similarly, our groups and classes for family members and friends are facilitated by people who have that lived experience as a family member or friend. So we're really trying to create a community where people can hear from other folks who have that lived experience and who have been through something similar as what they have gone through. So that's enough about us. You can see some links in the chat for more information, but I am going to, again, in the interest of time, I'm going to turn it over to our first speaker, Melinda, who is going to be introducing us to supportive housing and talking about eligibility. So thank you all so much again for being here, and thank you.
Hi, good afternoon, everyone. I'm here to explain about supportive housing. So supportive housing is brought about through the Office of Supportive and Affordable Housing and Services. They work on developing permanent housing for individuals who had been formerly homeless. So this department works closely with HRA, the Department of Social Services, government agencies, other non-government service agencies to develop new housing programs so that people who have been homeless or at risk for homelessness can find housing and live a very highly functioning life in a safe environment. So supportive housing is affordable housing with supportive social services in place. Individuals and families who are homeless or at risk of being homeless are eligible for these types of housing. So the types of housing that supportive housing are community residences or apartment treatment, as well as community residence SRO. So these types of housing, community residences SRO, or apartment treatment, are considered supportive or level 2 housing. Community residences are typically one site with 10 to 20 people living in that site. People typically share a bedroom, share the bathrooms, common spaces. They have meals prepared and are served in a communal dining room. So in this type of setting, you want to think college dorm because the bedrooms are shared in that type of way. Twin beds, shared 2 dressers, bedside stands, their own closet, key to the room, and they share all the other common spaces. Sometimes there are single rooms in these settings.
Wait, who's sitting?
So that's a community residence. A community residence that's an SRO is typically where people have either their own small studio, a little kitchen, bathroom, and a bedroom living area, or it's a 2-bedroom apartment where each person has their own bedroom, they share the bathroom, a living space with kitchen. This is sort of like an apartment building, but there's staff there 24 hours a day. So in these settings, a community residence or community residence SRO, staff are on site 24/7. The staff are there to provide assistance with these persons who reside there. So their job is to create a personalized service plan in conjunction with the person who lives there based upon what their goals are. Staff in these settings will help people learn their medications. They will help them with money management, how to budget their money, how to open up a bank account, how to maintain a bank account, how to pay their bills. They will help them with harm reduction if they have a history of substance usage. They will help them with their daily living skills, such as maintaining their apartment, doing laundry, maintaining their hygiene. They will also help them with issues such as linkage to services, health providers, education, and vocational services. So they're there to help these persons become more independent and stronger in those independent skills to move on to a more independent living level. This also happens in a CRSRO. Staff are available 24/7 and they provide these services. In these settings where staff are available 24 hours a day, they also provide services for the community as a whole. So they provide on-site activities, they coordinate off-site trips. They also have specific groups that happen during the day, as well as community or resident councils where the staff and the clients, the residents work together to create new ways of helping the people in the community by coming up with new ways of providing a service, such as the meals, or working together to bring speakers on site to provide additional information to them. So it's a collaborative work where the clients work with the staff so that they create a better and more supportive environment for them to become independent. So that's supportive level 2. Another housing level that's in supportive level 2 is apartment treatment. So apartment treatment are where people live in the community in an apartment with 3 other people. So 3 to 4 people in an apartment in the community. Typically people have their own bedrooms, but sometimes they have to share a bedroom. So in this situation, the residents, the staff, the clients live in the apartment. They may have their own bedroom, but they share the bathroom, kitchen area, and living room. Staff will come and see them at least once or twice a week, and they will provide the same services that they do for people in a 24-hour supervised setting. They'll help them with medication, they'll help them with their cleaning, they will link them to services, they will provide education about harm reduction, and all of those other services. They're not on site 24 hours a day, but they're available 24 hours a day. So this setting is a little more independent than a community residence because they're living in the community in an apartment that they're maintaining with the help of staff. So in these types of housing levels, the main source of income or payment for fees is typically Social Security disability, or public assistance. And in these situations, the fees for these types of housing levels are $1,053. Sounds like a lot of money. They may, but what's happening in these settings is that the fee is based upon the fact that you've got staff available to you 24 hours a day, and their job is to help support the person who's living there by helping them gain skills so they can move on to the more independent living level. So that's why the fees may appear a bit higher than the next level that I'll talk about. So that's supportive housing level 2, community residences and apartment treatment. So then the next and most highest living level is supported housing, supported with ED at the end. So this housing level is for people who are more independent, and this level is where people live in the community in an apartment, typically a 2-bedroom apartment. They have their own bedroom, they're sharing the common spaces, or it can be a studio apartment. In this setting, supported housing, the fees are a third of the person's income. So in this setting, the agency will hold the lease. The person who is living there, the client resident, will be the subleasee. They will pay a third of their income to the agency, the social service agency, and then the social service agency pays the landlord. So this is the most independent living level. It's permanent housing. People are independent in this setting. They can maintain their meds. They can plan out their day, do the linkages to social services, or they can work in these living levels and manage their day. The staff will contact them once or twice a month, see how they're doing. If they need support and other linkages, they will help them in this setting. But it's the most independent setting that there is. And that's also considered community care. So it's supported housing community care. So those are the housing models that we have. So in all of these housing models, they're all maintained or supervised by the Office of Mental Health. And people that live in these housing typically have some sort of mental health diagnosis or issue. So they can have major depression, major depressive disorder, bipolar disorder, schizoaffective disorder, schizophrenia, generalized anxiety disorder, PTSD, borderline personality disorder. So these are the types of people that live in these settings. And these are people that are more likely to have limitations that may cause them to end up homeless. And that's the goal, is to prevent people from becoming homeless by providing them with stable housing with services in place. So those are the people who are eligible, someone with a mental health diagnosis. Next are the populations. So these types of housing, again, are typically for people who have a mental health issue. So, but the HRA provides housing to many, many different types of people. So most of people are over 18, they're adults, or they're a young adult, which is ages 18 to 25, or their families, or their young adult families where they had households between 18 and 25. So they break down eligibility by what's called POP A, or POP A, POP B, POP C, as you see on the list. So, and this is just clarifying if someone has a mental illness and has been homeless, or as a family had a household has a mental illness and they have had a history of homelessness. The other populations, like POP A, are chronically homeless people with mental health and substance usage. POP B are adults who have come out of the state hospital system. So there's also a lot of people that come from state hospitals like Creedmoor, Manhattan Psychiatric, Bronx Psychiatric Center, Rockland County Psychiatric Center. So these are people that specifically come from those long-term inpatient settings. They're considered POP B. POP C are the youth 18 to 25 who've come out of a state hospital. POP D are families who have been chronically homeless, where the head of household has a mental health or substance use issue. So those categories, again, are for people who have mental health issues. But if you don't have a mental health issue and you've been homeless or you struggle with substance use issues, there are other POPs for you. There's a POP E, F, G, H, I. So this grouping, the priority or the initial issue is substance use, it's homelessness, it's chronic homelessness. So those are the main things that come out. They may not have a mental health diagnosis, but they have something else in those categories. They also include people who are HIV in these populations. So that's POP H, that's people who have HIV or AIDS, who have a mental health issue or substance use. So when you're looking at housing, these other POPs, POP E, POP F, POP G, POP H, POP I, there's specific housing for those persons. So don't be concerned if you don't, it's not the first thing that you see out there, but there are specific housing programs for these groups of people. So they're out there, and when you complete the application, which is the next part of the the training, the test session that we're doing now, that they will describe in more detail to you about how to go about applying for these housing services.
Awesome. Before we finish up talking about eligibility, can you, Melinda, define homeless and chronically homeless? And can you say if those definitions have changed at all because of COVID?
No, they haven't changed because of COVID. So chronically homeless would more than 3 to 6 months. They consider like chronically homeless are people that have, you know, these ongoing lengths of time of being homeless. 1 month, 1 to 3 months. They're homeless. They maybe find a place. They're back on the street for another 1 to 3 months. So that's chronic homeless. Or they, you know, they're living in an apartment for 2 years, but then they're back on the street for another 6 months to 2 years. So these are people that have repetitive kind of stints, should I say, out on the street. So that's chronic homelessness. They have, and they started doing more initiatives with the homeless instead of, you know, just getting them into the shelter and just trying to motivate them to get into housing. So as soon as they get into the shelter and they're like, yeah, I want to get housed, they just start moving them through the process. So I know that we have some housing people. We have a program that has, we're housing people that have been homeless through the public transit type system, where those people where they were trying to help them, who get them off the subways and get them into safe way shelters. So they are trying to do more programs linking them to housing, which I think they probably will increase those types of housing choices that they have, because there's a lot of people that are homeless. We have a long history of homelessness, and I'm sure that we see a lot of that now with COVID, what's going on. So I think that they'll probably just increase the number of supported housing beds that are available to agencies, and they'll probably find another way of linking people more quickly together with housing. And it's 3 to 6 months is like chronic homelessness.
Great. So we're going to, so I know there was an additional question of how that record would be kind of proven through DHS records or through the shelter system. And I think that we are going to be talking about that in the next section, which is the application process. Is that correct, Sammy?
Okay. Yeah. I can go into that.
Awesome.
All right. So hi everybody.
Hang on one second. I'm just gonna pull up our next set of slides. So sorry. Okay. There we go.
All right. Okay, everyone. Good afternoon. My name is Sammy D. Santana. I am a part-time peer specialist and part-time program manager for Baltic Street AEH. Joining me is also Anthony Sgarlato, who is the program manager for the Brooklyn Peer Advocacy Center. We're kind of gonna do an overview of what the application process is, and we're also hopefully going to answer your questions as to what this fabled 2010E application that everybody is familiar with is about. Clara, we can go to the table of contents. All right, so it's going to be pretty short. We're going to do the definitions, then we're going to move into the documentation that you're going to need, which is a Psych Eval, a psychosocial profile. There's also some medical documentations that you're going to need. Then we're going to quickly go over what a support team is, kind of like a timeline of the process and how long this will take. And then also we're quickly going to go over the documentation that you will need when you actually interview for the vacancy that you will be placed in. So we can move on to the next one. Thank you. All right, so we're quickly just going to do a few definitions. I know Melinda touched on some of this, but just for clarification purposes, because a lot of people ask us, you know, what is considered homelessness or what is considered SMI. So this is based on, you know, what the HRA and the state say. This is kind of like legally on paper what the official definition of a serious mental illness is. So basically, it's a primary diagnosis in mental health, which does not include substance abuse disorder. So usually it's these main are kind of like what they're looking for when you apply. Schizophrenia, psychotic disorders, bipolar, major depressive disorder, and borderline personality disorder. Now, I want to point out that it's limited but not including two, so you don't necessarily have to have these. These are just kind of like the generalized things that they look for. But if you don't have this, you still do qualify. Let me just clarify that, because a lot of people think that if you don't have one of these, you're automatically disqualified. That's not the case. This is just kind of like generally the main things that they look for. Also, you have to be receiving SSI or SSD due to a mental diagnosis that is mandatory. Now, it gets a little tricky because aside from those two, you either have to have difficulties in self-care, difficulties in activities of daily living, difficulties in social functioning, and also difficulties in completing tasks. Basically means, for example, you're not able to, for example, bathe yourself, or you can't cook, or whatever the case may be. And also a history that shows a reliance on psychiatric treatment, rehabilitation, and support. This is basically, for example, you see a therapist every 2 weeks, or you see a psychiatrist once a month. It's not limited to that. You can also see a social worker or a mental health professional. These are just, like I said, general guidelines. You don't have to specifically see these things, but as long as they're within those lines, qualify. Clara, we can move on to the next one, please. Someone asked this not too long ago, and Melinda also touched upon this. So things change. So last time I checked, this was officially what was considered homelessness. There might have been an update and they might have changed it, but basically the official definition is an individual with a disability who lives either in a place not meant for human habitation, a safe haven, emergency shelter, or a institutional care facility, which can be like a psychiatric center. That's the definition of homeless. Chronically homeless is you are living in one of the above situations for at least 6 months. I've been told is 6 to 12 months. It can be a continuous 12 months. It can also be for separate occasions where it adds up. Like, for example, you could be in one place for 4 months, and like, let's say 2016, then the year after that, you were in another place for 4 months, and then a year after that, you were in another place for a certain amount of months. As long as it adds up to 1 year total, it's fine. Also, the only other requirement is that you were at the facility or place for a continuous 7 days. Clara, we can, next one, please. Okay, so the documentation you will need, there's the main four: the psych eval, psychosocial profile, and the physical stuff. So for the psychiatric eval, it has to be filled out by a licensed clinician or a professional that's considered of professional standard to fill it out. Usually it's a psychiatrist, psychologist, psychiatric nurse practitioner, or medical doctor. In the case that you do not have one of these, as long as the person is licensed and has the proper certification to legally fill out a evaluation or summary, they can do so. Just in case you don't have access to any of these, it does have to be on an official letterhead from the agency or the person or the private practice doing it. It also needs to have an actual physical signature on the actual evaluation. If they have a signed one, or they have DocuSign and they can digitally put it on there, that's fine, but it needs to have a physical signature. Also, the license number of the person filling it out, and it has to be within 180 days of when you submit your application. If it's past that or before that, they're not gonna consider it valid. Clara, next slide. Same thing with the psychosocial. Just to point out, there's difference between the psych eval and the psychosocial is that the psych eval is more about your actual diagnosis. Is more of a mental document. It focuses more on your diagnosis, how it affects you, what things have happened because of it. The psychosocial is more about you as a person. You know, it focuses on you growing up, what kind of childhood you had, what kind of education you had growing up. Did you have friends? How was your relationship with your family? It's more, you know, personal, more about you. But the qualifications are almost the same with some minor differences. It can be done by a social worker, a mental health counselor, a licensed medical doctor, a case manager, social worker, discharge planner. They're a little bit more lenient with the psychosocial than they are with the psych eval. But same requirements. You need it to be on official letterhead. It has to be physically signed. It needs to have an NPI number, and it has to be within 180 days. The difference between an NPI number and a license number, license numbers tend to be more for psychiatrists. NPI is a national provider identification. Don't quote me on the exact definition, but it's just a number that identifies the person and what, you know, their legal medical status is. Clara, next slide. The medical is kind of the easiest. You just need a physical exam done by your doctor. When you go to your doctor, you say, hey, I want to get a physical exam, and then they're going to take your blood pressure, your glucose, all that wholesome good stuff, and they just print it out, they sign it, and pretty much that's it. Because usually when they print it out, it's on an official letterhead, and the doctor just sign it, and usually they stamp it, and the stamp has like their name, their license number, and all that stuff. So it's a little bit easier because you just go get it done. They print it out. Usually you can pick it up in 7 days, or they email it or fax it to you. So that's that. And then the last thing is the Ppd Tuberculosis Results. Basically, it is the exam they give you to see if you test negative or positive for Ppd. I know they have the shot for people that are allergic. They kind of inject a little bubble into your arm, and depending on the reaction to your bubble, it determines if you're positive or negative for TB or next slide. Support team. This is a big one. So basically, your support team is the people that support you through this process. Usually, it will be your psychiatrist or psychologist, whichever one you have, because obviously they're the one you're going to and talking to about your diagnosis. Your therapist as well. Your emergency contact, which is the person we call in case it's an emergency, your phone is disconnected, you missed an appointment a few times, and they're trying to contact you. And then the support person can be anyone that is pretty much supporting you in this process. You know, you have spoken with them about this, you're open with them about your diagnosis, you're telling them, hey, listen, I'm gonna go fill out a supportive housing application. They're basically the person that's there for you. So it's not limited to being a family member. It can be a friend, it can be a coworker, just someone that's actually going to be there and help and support you throughout the process. That's what's considered a support person. And they are part of your support team because they're with you on this journey. Clara, next slide. All right, so I think I'm kind of running out. So we're quickly going to go over the process and the timeline. On average, it takes about 6 months to a year from the point in time when you submit the application to the point in time where you are actually in the unit you are placed in. It can be shorter, it can be longer, but on average, it's usually 6 months to a year. Basically, I'm quickly just gonna name a few because you're gonna hear these names a lot throughout the process. So DHS is basically the Department of Homeless Services. They're usually, when you're homeless, they're usually the first point of contact you have, and you kind of go through them before you go anywhere else. PATH is the Prevention Assistance and Temporary Housing. They're the same thing as DHS, but they cater more to families or individuals that either have children or are married or, you know, have children 18 and over and under. If you're a family, usually you will go through PATH instead of DHS, or you will be eventually referred to staff. Okay, agency, okay, so CAPS is the system that we use to fill out the application. It's called it stands for Coordinated Assessment and Placement System. Is basically the, I guess, software, you could say in a way. It's the operating system that we use to submit your application. This is where all your information goes, then it's submitted to HRA, and then this is how they determine whether or not you are eligible or not. The documentation we just went through, the 2010E application. So basically it is an application that gets submitted to HRA. This application contains the psychosocial, the psych eval, your physical, the PPD, along with a whole bunch of questions like, for example, your housing history for 4 years, your diagnosis, are you taking any medications, have you been to treatment, stuff like that. That together with your forward documentation gets submitted to HRA. And then eventually it's gonna be on the next slide, 2 to 4 weeks, you'll get back a determination letter. That determination letter will say either A, you've been approved, this is the level of housing you qualify for, like Melinda touched upon earlier, or it will say B, you have not been approved, this is the reason why. Some things are easier to appeal than others. Like for example, if they say the psychosocial did not contain enough information, that's something you can easily, resubmit, taken care of. But something a little bit more like, we feel this person does not qualify because we feel that they don't fit the definition of the SMI, that's a little bit harder to fight, but you do have the option to say, hey, listen, can we redo my application? I think you guys might have made an error. All right, next slide. Okay, so, all right. So basically you would do an intake with the agency provider, whoever it is. We do 2010Es, agencies like Housing Works do 2010Es. If you're in a shelter through DHS or PATH or any of the other providers, you should have a housing person assigned to you after they do your intake. They will meet with you. They will ask you these questions. If you don't have the documentation, they will help you get it. They will start the process. Once they have everything, then like I just said, they will start submitting the application. It takes about 2 to 4 weeks. Then after that, you get the determination letter. As I just said, Clara, next slide. Okay, I saw people mention SPOA. We just got into SPOA. So once you get back your determination letter, the next part is if you're approved, then we have to take your determination letter along with a few other documents, and we submit a packet to CUCS, which I'm sure a lot of you have heard mentioned, which is the Center for Urban Community Services. We send a wonderful, like almost 30-page packet to them. Then they send us back what is called a referral. It's a piece of paper that has 3 agencies that, based on what was on your documentation and the application, they determine that you are best matched for. These are the 3 places that they feel that you will receive the best level of service. And then what we do after that is we follow up with those 3 agencies listed on the piece of paper, and we try to schedule an interview for you. So you can meet with the actual provider or agency or wherever it is. So for example, let's say we get your referral and it'll say, for example, just randomly, ICL has a vacancy. We want to interview your applicant on Thursday, June 26th at 3 p.m. because we have a vacancy that we feel they qualify for. Then we work together with you or whoever your housing person is to schedule that interview, get you into that interview, and hopefully it works out. When you're on the interview, they will explain to you pretty much what type of program it is, what type of housing it will be, whether, like Melinda said, it's level 1, level 2 apartment treatment, whatever the case may be. They will also go over what kind of support services they offer and also what the cost of the actual thing is. After you do the 3 interviews, you have the option to pick whichever one you have. If they have a vacancy, you don't have to necessarily pick the first one and say no to the others, they will give you some time to consider your options. Also, just keep in mind that all the interviews might not happen back to back. You might get one in a week and you might get another one 2 months later. So just as a side note, these things will not always happen right away, but just keep that in mind if you do apply. Clara, next slide.
So I think we're actually going to have to,
Out of
I know
time?
there's some, yeah,
Okay.
we're a little bit, we need to get on to the next section, but I
Okay.
know there were, but we're going to be coming back to a lot of this information during the
Okay.
Q&A, because I know there were a lot of questions,
Of course,
particularly
yeah, they were all
about
flashing.
just about the first slide. So we're not the first slide, I'm sorry, the one with the like, and SSI and or you know, difficulties with daily living, etc. So we're going to go back to that. But for now, we are going to move on to the last section of the presentation, which is about what living in supportive housing is actually like. So I'm gonna come out of here and we're going to come back to our last section. Hazelin, could you raise your hand for me? No, you are having some technical difficulties earlier, but we want to find you. Ah, there you are. Come back. Okay. All right, there we go.
So,
I'm going to pull up your slides as well.
Okay. Good afternoon. My name is Hazelin, Hazel-Singh. I have worked in supported housing for quite a few years, about 18. And this afternoon, I'm tasked with the opportunity to share with you what supported housing looks like. You've had a lot of really good information as to how you can apply, the different types of housing. And I just want to perhaps focus a little bit more on supported housing. So as Carla brings up the PowerPoint, I guess we can just
Sorry.
a little bit about, that's okay, talk a little bit about what supported housing looks like. So,
and I think Hazelin, just so you know, there were a couple of questions about what to do if you want to change, if you're not happy in your supportive housing situation. So,
so
you know.
One of those slides actually talks about it being voluntary. So we'll talk a little bit about that later on. So supported housing, and I know that Melinda shared on this a little bit, but it is a combination of afforded housing. And for the most part, it's for vulnerable individuals. I know we talked a lot about homelessness, but supported housing is for more than people who have experienced homelessness. It's for people who have experienced extensive hospitalizations, incarcerations, people who are aging out of foster care, people who are working on reunification and may have a mental health diagnosis. As we discussed earlier, there are basically two types of supported housing. And of course, it's a single site, what we call congregate care. And that's where you get to share a big building with lots of other people, and you have the opportunity to receive that 24 hours staff support. And then of course, there's scatter site units, and this is mostly housing in the community. It could be in a 1 or 2 or 3 family house. And of course, it can be an apartment out in the community. Thank you, Cara. Great. So let's talk a little bit about who are vulnerable. So earlier I said, you know, supported housing is for lots of different populations. And I know that earlier we focused a lot on homeless. People who are
Hang
homeless.
on.
But
Hazelin, I'm sorry. Can you see the slides?
I can, but we're like way ahead of
Okay,
where we should be.
sorry.
That's okay. You can perhaps maybe double click on it and then it will, that's where I think we should be.
Right here?
Mhm. And then maybe if you click, the wording will come up.
It's not, I think
It's not
we're,
coming up?
yeah.
All right.
So that's fine.
don't-
I'm gonna go back to the, sorry,
Mhm.
folks. There we go. Okay, can
So-
folks
so
see
here-
the words now when it's not in full screen
yes,
mode?
we can.
Great. That's what we're gonna go with.
All right, so we'll move from here. So when we talk about supported housing helps in so many ways. Stable housing is really important. And as you notice on the screen, supported housing helps family, it helps to, when you're not housed, of course it creates stress. It creates school instability because if you're moving from shelter to shelter, your child can't be in school consistently. It creates difficulty with substance use because as we know, oftentimes when someone is using substances because of some form of stress or some other issue that they are addressing through substance use. It negatively affects chronic medical conditions because of course you're not housed, you're not consistently going to the doctor, and it might result in increased emergency room visits. It might cause you to be, for someone who might be struggling in terms of managing their environment, they might end up in jail or prison. And of course, when you are not housed, it increases isolation. Next slide for me, please. So, supported housing, it's more than affordable housing. And I know a lot of times when we think about housing, we're like, well, I just want to be able to pay my rent. Supported housing is a lot more than that. It helps people with disabilities maintain a safe, decent housing. It allows for stable housing. And as we know, research has shown that when you are in stable housing, you're likely to recover better. And so that's part of what supported housing do. There's a list here. It says it helps with substance use services because it allows you to be connected consistently with services. It allows for intensive coordinated services, care coordination. It allows if you're aging to be able to age in place. We know that as people get older, sometimes they do experience mental health issues or other issues. And for the most part, might end up in a nursing home. When you are in supported housing, it helps you to maintain your housing because you have these wraparound services that can provide the support that you need to ensure that your needs are being met, whether it's medical needs, whether it's psychiatric needs, whether it's even in terms of food and so on, food insufficiency. It provides you with a service provider, whether it's a case manager, a recovery coach. You have a whole set of services that allows you to be stable. And it allows privacy as well. So if you're, for example, homeless or living in a home where there are lots of people, at least you have, particularly if you're in supported housing, you have a door you can close. Even if you're in a congregate setting, you have a door you can close, which allows privacy. So like I said earlier, supported housing is more than affordable housing. It is services that allow you to stay connected and allows for your recovery. Next slide, please. And you might say, well, sounds good. But what is it that someone who moves supported housing, what is it we should expect? What are the things that are important, particularly for agencies that provide housing, which is the type of agency I'm a part of? Could we move to the next one, please? So supported housing is generally housing oriented. What does that mean? It means that the intention is for the person to remain housed. It also speaks to us focusing on providing you with suitable housing. And you might ask, what does that mean? Many of us live, we live in many neighborhoods throughout, whether it's Brooklyn, the Bronx, Manhattan. And you might say too, let's say Sammy is providing you with some services around getting your HRA done. And you can say to Sammy, because there's a part in your HRA that asks what borough would you prefer? And you might say, you know what? All my relatives are in the Bronx and I'd rather live in the Bronx. That's what supported housing does for you for the most part. It allows you to be housed in a community that you're comfortable in. It helps you with the support of whether it's a case manager, a recovery coach, or that particular program staff. They help you to build a relationship with your roommate. It helps you to build a relationship with your super landlord, understand your rights and responsibility, and ultimately help you attain permanent housing. So as you're looking at supported housing, you are looking not just at what's happening right now, but that ultimate goal of being independent. Next slide for me, please.
So we've just got just a couple more minutes. Is there a point that we wanted to
let's go all the
ahead?
way. Let's go to 11, please.
Great.
So earlier someone asked, what do I do if I'm in the supported housing and I don't want to be there? Supported housing is voluntary, and that is a good thing. Because then if you choose to be discharged, you can be. You don't have to be stuck in a housing arrangement that you're not comfortable with. And for the most part, that program provides regular evaluation around how you're doing, are you accomplishing your goals, and so on. Outside of that, you are encouraged to participate, because participation is what, helps to make you feel better and helps you to accomplish your goals. Even though it's voluntary, I must say that because of the nature of our programs and our responsibilities, if for any reason you begin to isolate or say, well, I don't want to meet with, the providers, they do have to do wellness checks because we do need to make sure that you're safe and you're fine. Let's go to 13. Choices. You have a choice. You have a choice in terms of your housing options. You have a choice in terms of the goals you want to work on. There are no curfews and you can have visitors. So supported housing, you have choices, and having a choice is important. Let's move on.
Which slide?
I can't really see that, maybe 14. You might say, well, are there barriers, right? Earlier, I know we focused on homelessness, but I want you to know that in supported housing, there are no barriers really. The truth of the matter is, once you have a serious mental illness, you qualify. It's not just about being homeless. So there are no real benchmarks. It depends, there are lots of supported housing and the requirements vary. You can have a history of incarceration. You don't necessarily have to be employed. You can have a substance use history, or you could be a current user. You don't need to have perfect credit. Those are the things, Supported housing is about hope. And so you have an opportunity to be housed regardless of what your circumstances or history has been. In fact, supported housing for people who have experienced traumas and all kinds of difficulties. All right, I'm gonna go to the 15 and then I'll just wrap up. So when I started off, I said supported housing is for people who are vulnerable. So you have an opportunity to obtain affordable housing. And like I said earlier, it's more than affordable housing. You have support. You have a whole team of staff supporting you, helping you, providing that encouragement that you need to accomplish your goals. And not just for you, but your family as well. you have that opportunity to have your family be a part of your treatment goals, if that's what you want. And if you don't want that, that's okay as well. It allows you to, return to that place of normalcy, because sometimes when we're homeless or when we've experienced incarceration or any type of trauma, you tend to feel separated from society and from normal experiences. It gives you the opportunity to do that. So it enhances your self-worth, your self-efficacy, and it gives you that ability to be responsible for your space, to pay your rent, to clean your apartment, to collaborate with the people who are providing services for you. And it really allows you to improve your overall sense of wellness. So that's what you can look forward to when you are in supported housing. You can look forward for growth, you can look forward for recovery, you can look forward for freedom and independence. All right, so let me wrap up there. I'm just going to give a very quick story and then I'm out of here. So we had a young man who came to us. He came to us with substance use, struggled with substance use for quite a few years, but he's been with us for 10 years. He was overweight, wanted to do bariatric surgery, wanted to really get better. It took some time, but I can tell you over time, even though there are times when he may have relapsed, he got to a place where he was able to have his surgery. He is losing weight. He is not using. And that's because he will tell you he's always had a place to call home. He was not on the streets. He didn't get incarcerated. It reduced his hospitalization because he was also what is called someone who used the emergency room a lot. So there are lots of success stories in supported housing, and I'm sure that you probably hear another one, but know that supported housing is a place of hope and that you don't have to feel that this is not for you. It can work out, and it can work out well for you and improve your recovery. Thank you.
Thank you all so much. So I know that there are a lot of questions that have been building up in the chat. And I also know that this process can be really frustrating for folks. So I really want to get to the questions part of this to maybe address some of that for folks. So I have a list of many questions that people have been sharing throughout the presentation. I know there's a couple of categories that they sort of fall into. So we're going to try to sort of address questions in all of these categories. So there's a whole bunch of questions about what to do if you're not satisfied in your supportive housing program. There's a bunch of questions about what to do if you are trying to access this and you are not getting responses. There's people are not helping. I know that's a really real thing that a lot of people face. And then there's a sort of and then there's a set of questions about sort of what about situations where somebody may be living with a family member, but that situation is not tenable because of the issues that are coming, the interpersonal issues that are coming up, whether they're related to the mental health issue or not. And so the person isn't homeless, they have a place to stay, but they need to be getting into other housing. So that's sort of some of the categories that I'm going to try to make sure that we cover. I want to start off, with sort of what do the options look like for folks who may be living with relatives, or maybe living with relatives, maybe living with parents. They're not homeless, but they really need to get into their own housing, but they're not able to, work and have their own apartment. What is a place that people in that situation can start? And I think maybe, Melinda, if you want to go ahead and start.
So I know that, I work for Transitional Services for New York. So I know a lot of the time, we offer, the gamut of services, outpatient mental health, and all of the levels of housing. So a lot of the time we get calls from people who have living with a family member and they're struggling at home. So if this person that they're living with is seeing a psychiatrist or therapist, then if they're able to access the HRA, that they can do that for them. If they don't, then they can get what's known as a care coordinator. And this is something that, our agency and many agencies provide. This is a person that could help them complete that HRA packet for them. So they don't have to be homeless. They don't have to be in the hospital. We've had people move directly from living with their family member into our housing. And I'm sure Hazelin would agree as well that that happens a lot. People call agencies a lot and to try to locate housing. I don't know offhand. People I'm sure call 311, but if there's an agency that's near you or any of us, I'm sure could help direct you in the direction of what to do if you have someone at home who, it's becoming more challenging and they need to have their own space. So we could address those issues specifically with you, I'm sure. But
yeah. Did anybody else want to sort of address that situation of our speakers?
Clara, can you hear me?
Yeah. Mm-hmm.
Okay. Continuing what Melinda said, there is a hotline from the city called Wellness New York. They could connect you to 311 if you're, because I saw a few people asking how do I get connected to a care coordinator. They can do that for you. I know they have their own 3-digit extension. Right now, I cannot remember it, but if you do call 311, you can ask them to be connected to NYC. And basically that hotline is specifically for mental health services. If you want to get a care coordinator, if you have any kind of general questions about mental health, if you're looking for a provider or to receive services, they can provide that for you and they can possibly link you to someone, just to add to what Melinda was saying.
Yeah, and can you, I know a couple of you mentioned, I'm sorry, Hazelin, I know, June, would you be able to make Hazelin a co-presenter so she can unmute herself?
Yes.
A couple of folks mentioned care coordinator. What's the best way to get a care coordinator if that's not somebody? How can folks sort of get that person who can help them with this process, as it's long and confusing, and we definitely know that that's really challenging for folks.
So for many, most clinics, if you're going to a mental health clinic, almost every mental health clinic has a care coordinator. And so you can request to connect with that care coordinator. Also, almost every hospital has a care coordinator. I noticed that we got the number out there, but every hospital has a care coordinator. If you were to go to the ER for any reason and you needed care coordination, you can say to the social worker there, I need a care coordinator. I need help with its services. It's very, very easy to obtain. The only little challenge is that you do have to have Medicaid because care coordination is paid for by Medicaid, sorry.
Cool. Yeah, I think there's definitely a lot of questions about how to just increase access to services overall, because we know that there's a huge need, especially in the wake of COVID, and the services that exist are not sufficient, and we know that. So we're definitely trying to navigate what's there, and help folks sort of with that. And I know that if there are questions that I'm sure that there will be additional questions after this presentation, because we can only cover a limited amount in the time that we have. but I definitely want to encourage folks to reach out to our helpline, and we'll be sharing additional resources in the email that goes out after this presentation. Okay, so there's a couple of more specific questions. So, oh boy, okay, there's a, yeah, so for folks that are in, actually in housing, what's, and if somebody's not happy, if they get into housing and then they're not happy with their sort of situation, what recourse do they have, and what does that look like once somebody's actually in the system?
So being in housing don't necessarily mean, so to speak, being in the system. Being in housing, almost every housing, it's voluntary. So you have a choice. Almost every single, I am sure, every single organization has what is called a grievance policy. And so if there's something that's going on that you are unhappy with, there's a process by which you can put in a complaint and say, hey, I do not like my roommate because I am not a smoker. I asked them to not put me with someone that smokes. Or that you can say, I don't like this particular building because I don't feel safe. And you can say why you don't feel safe. And then that has to be addressed. So that's one of the ways that is addressed. Also, once you have a current HRA 20, which is what we've been talking about all the time, you can always ask the person that you're working with or the agency you're working with and say, hey, I think I want to be somewhere else. Can you look for more intake opportunities for me or other housing options for me? And so you do have options. I know that people feel stuck sometimes because, you know, it might be the case where you just got housing and you're afraid that if you leave here, you wouldn't find somewhere else. That's not always the case. There are opportunities, and you can advocate for yourself. You can get your case manager to, you know, stand in there for you, but there are other options. Also, there is something that is called, and I don't have all the information with me, but there was a program called the Moving On program. And what it allowed was for people who are in supported housing to get housing outside of supporting housing. Because remember, we were saying earlier that stable housing allows for recovery. And so once you would have gotten to a certain place in recovery, you might not need all those supports that you get in supported housing. And so you have the opportunity to move to something that is a lot more independent.
Okay, so there's a couple more specific questions. I'm not sure for those, can any of you speak to resources for or phone numbers that people can call for housing resources outside of New York City? I know we have somebody from Suffolk County, and there are, so if there are any resources for folks that are outside of the city, does anybody have information about that?
I can, give you a answer. Most of these programs are specific to New York City and the boroughs of New York. So, because I know we have situations where other people, like you just had mentioned, I'm from Florida, I want to move down there, or California, or whatever the case may be. I would suggest check with like whoever your local, community center is, or whoever your local contact person is, because these things are very specific to New York City, and we've seen that they're not really offered outside. They might have something similar that works more or less in the same way, but it's not, like specifically called New Jersey supportive housing. So that's something that they kind of have to do a little bit more legwork on and reach out, to their local provider or community center and see if maybe they have something similar.
Yeah, and I know in Long Island, I would just reach out to like the Nassau County Mental Health Association or Suffolk County Mental Health Association, and the application process in Long Island is SPA, the SPA housing, SPA Long Island housing packet. So that's a separate housing package versus the cities. but it's very easy to access and utilize. So.
Great. So we've got a couple more sort of specific questions, which hopefully will be kind of quick to get through. Are emotional support animals accepted in the supportive housing programs?
That is an excellent question. So yes, yes, and yes. The challenge sometimes, however, is finding someone who, because a lot of supported housing are shared apartments, and it's just finding that roommate who does not mind having maybe a dog or a cat in that apartment with them. But supportive animals, sorry, or therapeutic, they are allowed. So that is, you know, there's nothing that prevents you from accessing supported housing. There's no screen out.
And are interviews for housing virtual at this point?
Yes.
Yes, they are. I did a few today.
So did I.
Okay, there's also a question about payment. Do all OMH supportive housing units have a different rental payment agreement than that of New York 3 units, which I believe is almost always 30% of your income? I'm not sure I'm following that question, but maybe one of you can speak to it.
Well, all supported housing or community care level are 30% of your income. Everything else, community residences, apartment treatment, you're paying a monthly fee. And that changes either year to year or however they determine to make those changes. So it's different. And that's something that people get confused about a lot. Everyone thinks that the fees are 30% of your income at every housing level, but that's not the case. Again, community residences and apartment treatment, the level 2 supportive housing, you're paying for those services available to you 24 hours a day. So that's why there are fees which are higher than what they are in supported housing. And then there may be some SROs, which may have the fees may be less, but I don't want to confuse everybody about that. But there's 2 distinctive amounts.
Yeah, for folks that are experiencing, I know there's a couple of variations on this question, that are just experiencing really long wait times. So somebody just brought up a point, and this was addressed earlier in the chat as well. I have a client who interviewed with 2 agencies, but has not been placed for over a year now. Is there any way to get help? So, and I think that goes for a lot of people who had questions just about, you know, I've been waiting, I haven't heard back, I need to get a new provider, or what do I do in that situation? Is there any recourse for people in that situation?
I think if you've been, go ahead, Hazelin.
Yeah, I think there might be a number of reasons for that, but I want to touch on something really quickly before, something that Melinda spoke about, and a question that was asked earlier, and I'm seeing it in the chat, and it kind of concerns me because I know that sometimes there's this confusion, particularly about paying rent. And someone asks, if your income is $100, does it mean that your rent is $33 if you're cash? And I just want to bring to your attention and to the group attention that if you are on public assistance pays a shelter allowance. It was on one of my slides. So public assistance pay a shelter allowance. So you don't have to use your cash towards paying your utilities or your rent or anything like that. Your cash is used to pay other things, utilities, not rent, but utilities and other things. In terms of people who have applied to agencies and haven't gotten a response, some part of the thing is definitely follow up, right? Sometimes if you do, let's say I do 5 or 7 intakes in one day, I still have to figure out how to pair, who to put where, and so on and so forth. And there's a possibility at times that you may overlook someone. And I want to be transparent here. It's okay to call the provider and say, hey, I interviewed 2 weeks ago, haven't gotten a response. Could you let me know what's going on? If you have a support team like Sammy spoke of, that support team can reach out as well and say, you know, Mr. Y came on whatever day, we haven't yet gotten a response. Could you say why? And when is it possible for me to have, when can I have an update? Also, you may want to assess, speak with the provider and say, hey, is there something that might be preventing this person from getting housing? Because sometimes the person might not be at the place, they might be interviewing for maybe, let's say, supported housing, and they may have some challenges that might prevent them from effectively experiencing the quality of recovery that they need to, because supported housing is pretty independent. They might need to move their expectations a little bit and perhaps reach out to congregate housing, particularly if they qualify for level 2 housing as well. So it's more about a conversation, and they shouldn't hesitate to have that conversation, and always follow up when you, just like an interview when you go for a job, just follow up and say, hey, we met, haven't heard anything, could you give me an update?
Yeah. Can we go back to, there was some questions about eligibility, and then also some questions about how this works for families and how it works for couples. So if somebody is not homeless, but is living in a situation, for example, a very crowded, like family situation that is exacerbating their mental health issues, how would that affect their eligibility for to apply for housing?
Can you hear me? Okay, Melinda.
No, go ahead. It doesn't affect it.
Yeah, it doesn't affect it. The thing with the 2010 and the housing applications, they kind of have, for lack of better terms, quote unquote, minimum requirements, but they're not set in stone. You don't have to necessarily word for word, tick for tack, meet what they say. So in situations like that, for example, they say you need to have a history of homelessness, whatever the case may be. That's not set in stone. If you're living in a situation where you're with your family and so on and so, then you can explain to them, for the past 4 years, I've been staying with my family, friends, whatever. It's overcrowded, it's affecting my mental state and it's affecting me as a person. You can apply with that. It's not going to automatically disqualify you. Like I think Melinda and Hazel said earlier, it's an opportunity to apply. Even though there are certain, minimum eligibility, whatever the case may be, you're more than welcome to apply. It's not like it's going to automatically disqualify you. It's not like if one person who applied and had 1 year shelter history, and then you have applicant number 2 who's been living with their mom for 4 years, they're both going to be able to apply. It's not like the person with the shelter is going to get, a higher chance of you getting in there, or the other person. You're both going to be able to apply equally regardless of the housing situation for both. Melinda, I don't know if you wanted to add.
We've had people in housing that have come directly from residing with their family member for their whole life, and then they've linked to someone who did the application for them, and they're eligible for housing. So really, it's the circumstances of the person. Do they have a mental health issue? Are they able to maintain themselves? Is it the fact that their parent or their sibling or someone is really doing all of the stuff for them, managing their money, helping them clean, kind of giving them direction with day-to-day, supervising their meds? So there's all things that can happen in the home, with a family member for the course of their whole lifetime, and with other various issues, maybe substance use, maybe some incarceration, but they don't have to be homeless at all, and they can come into housing. And as Hazelin had said, that people who interview, typically you want to follow up about the interview, and you should have a clear answer about what level of housing you've been approved for. And if it's supported housing, and sometimes there are wait lists for supported housing, as well as congregate level housing. And that should be made clear to you from the housing provider you interviewed with. And you should follow up and have the person who's working with you continue to follow up. I had a lot of people who call me on a regular basis wanting to know where things are at. And we'll communicate with you as well, because we're going to be asking for things from you in order to kind of get your file and things ready for someone to move into housing. So it's a two-way street with communication.
There's also been some questions about family, how this plays out with sort of families. can you talk about supportive housing for families? Does the family need to be in a family shelter to access this type of housing? And if there's a couple and one person is living with a mental illness, but the other is not, how does that work for housing?
So in terms of families, you don't have to be coming from a family shelter in order to access supported housing. One party, mother or father, do have to be diagnosed with a mental illness. And that person is the person that qualifies for the housing. So that's it for a family. You don't have to be coming from a shelter. In terms of maybe partners where one person might have a mental illness and the other one might not, that's okay. We have in our program, we have quite a few partners who live together, and one partner does, he or she is approved for supported housing. The challenge sometimes is, and I want to touch on this really briefly, is that OMH has a regulation that if one party meets the criteria for supported housing, that party would pay 30% of their income. However, their partner would pay 50% of the rent for that apartment. And sometimes that can be a challenge, because if the other person is on SSI or some form of disability as well, it could be a challenge in terms of them taking care of their housing responsibilities. But that is not, like I said, there's nothing that should really prevent you from not being able to get into some form of supportive housing.
There's also been a couple of questions about getting authorized to complete the 2010E. How can somebody get trained to complete that?
CUCS actually provides training. They can provide training, your therapist or psychologist, or even if you were to get a care coordinator, might be able to help. There are lots of people who can help in that process. And if you're part of an organization, there's always someone who may be in the intake department who might be able to provide you with support around that.
There's also a question about what happens once the 2010E expires. And I do, Susan, I see it, you have your hand raised. Just because we have so many questions, I'm going to ask that you put your question in the chat if you can access it, because just that'll help us kind of keep things going at a good clip. So somebody who's living in asks that what to do if they're living in a shelter until the 2010E expired and they now have to do a new package. They're being told they have to do a new package. Do the decision makers take into account that somebody's already been waiting for a certain amount of time, or are they really back to square one once the application expires?
I can answer that. Once your application expires, well, first thing I want to say is if you are in a situation where you are in a shelter or with a provider, because I've seen this happen a lot, is people will be working with a provider, and if I would say follow up with them and do not be scared or do not feel that there's going to be some form of retaliation if you kind of go to their supervisor or their manager or over their head, or file a complaint with DHS or whoever governs the facility or agency where you're at. It's okay to do that, because it's your right as a applicant to, if you're working with someone, for them to follow up us. If you're working with someone and it's been a year and you haven't had any kind of follow-up with the person that did your application, that is a red flag. And as an applicant, you have a right to follow up and ask that person, what is the status of my application? Why haven't you followed up with me, with any fear of retaliation or thinking that your application is going to be tossed or whatever the case may be. And I encourage people, if you don't get results from them, like I said, go to the supervisor, go to their manager, make sure you keep documentation of when you met them, how many times, when it was submitted. So that way you have proof and you're covered, because you could say, on this day, it's been this long. So that's one thing I encourage a lot of people to do, because we hear stories like the question just said, where it's like, oh, we did an application together, I haven't heard from them, it's been a year. And I'm like, did you follow up with them? And they're like, yeah, but they never got back to me. So I'm like, go, but keep going. When it expires, you can renew and resubmit. Basically, most of your information carries over unless there's been changes to like your medications, or if you change providers, a doctor change, or your psychiatrist change, or your therapist change. Those things get updated. You will need new documentation, and the application that says resubmitted again, and hopefully you get the same approval. Things happen. Some people might get better. Some people might get worse. For example, you might have done an application last year and you were level 1. Some things happen. You went through some, emotional stuff. You're kind of like in a not so better place. Your rating might get changed. So just be aware of that also. Especially with the stuff that's on the report. Like, for example, if your original Psych Eval said, this person was doing great. And then next thing you know, when you renew again, your Psych Eval says, well, they're kind of having, occasional depressive episodes. That will kind of change your rating as well. But usually most of the time, if you were approved the first time and you resubmit, if everything is more or less within the same range of what it was when you did the original, you should be able to get the same approval rating. Unless things have changed, then that might change your rating the second time. I don't know if anyone wants to add to that.
Yeah, the HRA is good for a year as well. I think I just saw that in the question. So it's good for a full year, the HRA. So.
Yeah, after a year, if you haven't been placed, it will expire and you will have to renew again. Just to note that in there. So it's good for 1 year, but if you haven't been placed in a year, if you haven't gone to, like, let's say a provider and they haven't placed you, it will just automatically expire by default and you will have to do a new one. Usually whoever you work with will be notified by either HRA or CUCS, and they'll say, hey, your application for your client is expiring within a month. Can you please start the renewal process? They do notify us like a month before. So whoever you're working with should have a notification, and they should be able to let you, call you and say, hey, listen, your stuff expires in a month. Let's get the process started to get your renewal paperwork so that we can submit this on time.
We also let people know as housing providers, if we see we get an HRA packet that's going to expire in like a month, we know that our process probably is going to be a little bit longer than a month. We usually let them know ahead of time that, we can interview you, but we're going to still need you to reapply and get a new HRA for when they are admitted into the program. So we look out for that as well.
Yes, and HRA stands for Human Resources Administration.
Yes, that is correct. I just saw that flash up. Yeah.
So there's another question that is that hopefully folks can address, but I do want to flag 2 things. One, if the speakers can kind of keep an eye, I know you all are keeping an eye on the chat. If you see a question that you can respond to quickly, do feel free to jump in on that. And I also want to say that several folks are interested in having contact information of either at your organizations or that they can follow, or you yourselves that they can follow up with. And so we are going to, I'd like to share that at the end of the presentation. So if you can all sort of get contact information ready to share either for you yourselves or for your organization, that would be really great. And we're going to try to include that in the follow-up email as well. Okay, and one more question that's been floating around for a little while. And I've been trying to keep track of everything, but there's just a lot coming. So don't be nervous about putting your question in again if I haven't gotten to it. For those aging out of foster care, how early should they apply for assistance if it takes 6 months to a year for housing?
That's for under 18, you mean? I would say if you are in the foster care system, as soon as you hit 17, get the process started. Because the thing with young adults is that the age range is 18 to 24. So when you go from 17 to 18, if you started the process, you should immediately, the transition should be smooth right away. So I would say like as soon as you hit set, just start doing your research. I know agencies like Jericho Project are specifically for young adults. Rising Ground, which is in Yonkers and the Bronx, also has kind of like a similar transitional program when you're going from 17 to 18. But I would suggest like as soon as you can, just start looking at your options and start, figuring out what the process is, what you're going to need, what the requirements are, what the level of services, and just take it from there.
There's also, and I know we're wrapping up, but there was a question about who oversees these programs. So if there is something not right or being, not going well in a particular program, who's the agency that really oversees that and is accountable for these programs?
The Office of Mental Health oversees these programs. And certainly there's always the Justice Center. If anyone has a very urgent problem that they need resolved, people can contact them as well. But typically, as Hazelin had said, there's a grievance process within any of these housing programs. And I know that we're always open to hearing any issues or concerns, all the way up to our CEO. Again, it's the Office of Mental Health that regulates us and comes in and makes sure that we're doing our job based upon their standards, and we're audited and that we have to meet those standards. So that's who, and there's a number that that people can call. That's, I'm sure, provided because it's in their resident rights typically, so.
Mm-hmm. We're also some of the supported housing report to the Department of Mental Health, and that's the CT. So the Office of Mental Health State, Department of Mental Health City. All right.
Okay, so we are just at time. I know there's a lot of additional questions and concerns that people have. I know we weren't able to get to everything. There will be an email going out to everyone who registered for this presentation with all the slides that were shown attached and the handouts that we showed. So you will be receiving that. We're also going to try to just consolidate some of the information that was shared in the chat into that email. If our speakers could start to share that contact information in the chat. There's one announcement that we have for folks who are actually currently tenants or are sort of further along in the supportive housing process. There's a discussion that's being hosted. So we're going to do a quick announcement about that. And then I'm going to go through each of the speakers for them to pass on follow-up information. And you can also reply to the email that you will get because it will be coming from me directly, Clara, and you can reply to that. Okay.
Clara, can I just say mine over because I'm kind of on mobile, so I don't have the option to type. So the main office number for me and Anthony is 718-855-5929, 718-855-5929. My extension is 210. Anthony's extension is 201. I will also give you my email, but just for anyone that's interested, I will send my information to Clara and she can also send it out to everybody. I don't mind you sharing my email and the office number with everybody, so I will send that out to you. The email is S Santana, so SSSANTANA at balticstreet.org, and street is completely spelled out, so it's BALTICSTREET.org. And I will send it to you after, so if anybody wants it, you're more than free to send it out to whoever has requested it. And if you guys have any questions like regarding supportive housing, or if you need the PowerPoint, I don't mind sharing it. Also, I know a few people ask if we could do presentations. Feel free to reach out to me about that. I kind of had to discuss that with corporate first, because I'm not sure how that's going to go, but we're more than eager to, share these things with you, because we know there's a lot of questions and a lot of misinformation with the 2010E, the process and how it goes. And, we would like to try our best to kind of clarify it to everybody, so that way everybody has a better understanding, and it's not just, basing it on assumptions, or this person told me that, or that person said this.
Thank you so much, Sammy. And Anthony, would you be able to put his contact information in the chat again? That's perfect. All right, and we're gonna just make a quick announcement about the upcoming meeting for tenants.
Hi, everyone. My name is Sandra Gressel. I'm an attorney at Mobilization for Justice and our mental health law project. And I just wanted to let folks know who are currently living in supportive or supported housing, or currently in the process of navigating the application interview process. There is going to be a meeting next Thursday at 5:30 to talk about potential policy advocacy and potential tenant organizing around making improvements to the supportive housing application process and accessing supportive housing services. So I'm going to put my email in the chat, and if you're interested in getting the meeting information, please don't hesitate to reach out and email me. Thank you.
Awesome. Okay. Thank you so much, everyone. Do our speakers have any last final thoughts or information that they would like to share before we wrap up? I think.
Thank you for having us here. No, just thank you for having us here. And I just want to, whoever 10 was, good job at like running, because I kind of saw a few people in particular kind of mini moderating the thing, and I think 10 and 2 other people were among them. Good job. Good job. Thank you for that. I just kind of wanted to give them a quick shout out.
Yeah, thank you so much.
I'd like to say something.
Okay, yeah.
The whole presentation, Sammy did a great job. Melinda and Hazelin, I really appreciate being invited by you, and I hope that we can all provide the information that's critical to many that are in need here. Thank you so much for attending, and God bless you all.
Thank you so much, everyone. Have a great evening. Look out for that email. You can reach out to me directly, either by replying to the email or by emailing me here at ckiley, CKIELY at NAMI-NYC.org. So with that, I'm going to say good night. We're a little bit over time, but I'm really glad we were able to get all of this information out to everyone. I hope that, everyone took at least something useful away with them. And we know that there aren't enough resources and we need more, but hopefully something that you learned here will help you navigate the system and, get your needs met in the moment. So good night, everyone. For those on Facebook, thank you for joining us. This recording, again, will be available on the NAMI-NYC Facebook page. And will be sent out, a link will be sent out in our email after the presentation. And thank you so much to our speakers who really put so much work into trying to get a really complicated and confusing topic into something resembling order. So, we know it's a little chaotic, but we really appreciate our speakers and all of you for sharing your knowledge, sharing your questions, and being here with us.